Welcome to Let's Talk Space Medicine. I'm Kyle Anderson, your medical student slash space nerd host. For your listening entertainment, I gather my other medically inclined space nerd friends to talk all things space medicine. With our powers combined, we hope to explore and entertain the medical questions that stand between us and the stars. Today's orbit, space surgery. Before, during, after, or not at all. As a brief disclaimer, anything discussed on Let's Talk Space Medicine should not be considered medical advice, and is therefore not a substitute for seeking medical help from a doctor. We are simply interested in entertaining questions within the field of space medicine. And today we're joined by our normal space nerd friends, Ryan and Vlad. Always good to see you. And we are here on Orbit 8, and we call these orbits because we hope to, within an hour and a half, the amount of time it takes for the International Space Station to cruise around the world one time is one orbit, and that takes about an hour and a half. And so we are just a bunch of space nerds interested in talking about space medicine, and I was really happy to pick up this topic from a couple articles. It seems to pop up every once in a while. Where people want to just start cutting astronauts before they go into space. And really happy to talk with you guys today. We have Ryan and Vlad, medical students at Michigan State University College of Medicine, and myself, MD PhD student from Rush University Medical Center. And today I'll just toss it over to our good friend Vlad, who appears to be in a modern art museum with just a bicycle seat in the corner, and how you doing, my friend?
I'm going for a more what's the word that's used to describe architecture where you limit the amount of stuff that's in the room?
Minimalism?
Minimalism, yes. We're from minimalism look. So the only thing that matters in my life is the earth and transportation and exercise. Hence the bicycle seat. And I think it ties in the walls around me.
Okay.
But I've been doing great. I just got back from the Houston Space Center. I think it's the Johnson Space Center for museum. Oh, it was great seeing all those exhibits and learning kind of things I didn't quite think about, like bio-mining, using bacteria to break down rocks to get the materials that you need for future space exploration and travel.
I think I've heard of that space center before. I think I've heard of it, yeah. That's super cool, man. Very jealous. Tell us what you're doing down there besides visiting the space center.
At the moment, I'm doing an away rotation at the Baylor Medical School in medical genetics for adults. So I'm seeing patients.
Yeah.
Yeah, it's great. I'm seeing patients. I'm learning about different guidelines, learning about the different reviews that are available here. It's been great.
Yeah, and some of our listeners might pick up on some of the audio clipping and other stuff like that. That is not hotel Wi-Fi. It's just Vlad doing his robot impersonation. So
it's the Soviet brain chip of mine that I was born in Russia.
Yeah,
it's malfunctioning. So I do apologize for the hotel Wi-Fi, but there's not much I can do.
Well, hey, we're just happy to have you here. And looking forward to hearing more about Baylor College of Medicine. They do have quite a bit of, at least in my estimation, like a good footprint into the space medicine world. And actually, one of the people that we'll be featuring today is at Baylor. So maybe you'll say hi to him. And let's throw it over to Ryan. How you been, man? Joining us from the forest. Also, the bike seat exhibit seems to have made it to your side of the world too. Tell us how you've been and what's been up. You're currently muted, so I guess you're doing your mime impersonation.
Sorry, I had to pull the forest into the frame a little bit. But yeah, thanks for having me again as always. I appreciate how in the intro you introduced us as the normal your normal space nerd friends. I thought that normal might be a stretch, but Yeah. I'll take it.
Maybe just like routine is what I was going for. Like, people who listen to
okay. Yeah. Thank you for clarifying that for everyone. But yeah, man, I've been really well. I just started my third year of med school after a year of leave, so it's been kind of like a sink or swim, sort of jumping back into the saddle type of deal where suddenly I realized I forgot everything, and you have to relearn it all faster than is humanly conceivable.
Yeah.
But it's been a lot of fun. Right now, I'm doing an ambulatory internal medicine elective rotation, so that's actually been more chill. I think I have surgery next, so lots of fun stuff going on.
Well, I've heard that's chill too, so that'll be just fine.
Yeah. But hopefully after today, oh, this is a beautiful segue. Hopefully after today, I'll have all these like awesome things to talk about with surgeons because of all the thought we put into potentially doing surgery prophylactically for space travel. What do you think about that, Kyle? Whoa.
That's in terms of transitions, just good to clap that one out. That one's just great. So yeah, as Ryan alluded to, and as I've already introduced, we're talking about prophylactic surgery. So I don't know. I guess I'll just start talking a little bit. This is kind of one of the weird things about space medicine that seems to have come up. Like people, just think whenever you go to space, you're gonna like you should remove the appendix. You should remove like some problem things before you go. And I had never really heard of that, and so I'm really excited to talk about it today. What were you guys' like initial impressions when you first heard we were going to talk about this?
So for me, when we maybe I don't know, it's been a couple weeks since we like opened this as a possibility, right, for a discussion on the show. It struck me as something that like could be maybe plausible. But I don't. In most cases, probably not. That's kind of that my like gut reaction was. What are you thinking, Vlad?
I have mentioned that a good portion of that covers because, but I'm going
Oh,
to not think that prophylactic surgery was a good idea in astronaut space flight.
Kyle, did you what was?
Yeah,
what's your...
I got every third word on that one.
Oh my god!
I think what Vlad was trying to say.
You could do audio only if you want. Exactly. You could do audio only.
What I could do is I could join in on my phone.
Oh,
that's an option.
That's also an option.
I mean, audio only might work better, but I don't know.
Yeah, try camera
on. And off, and I'll just data for this because I care so much about it. All right, I'll be right back.
Sounds good.
Sweet.
Yay, broken overlay. Woo!
Yeah, I'm curious to see how that overlay changes.
I might just add...
Oh, there we go. That's not too bad.
That's not too bad. Here, let me just...
All right, how are we doing?
Okay.
Nice. Yeah, that works.
All right. So let's try this again. I'm gonna mention that I did not hear half your conversation, Ryan.
Oh, okay. So yes. So what I said before I tossed it to you was initially when we began talking about this, it kind of struck me at prophylactic surgery as an idea for space travel, like pre-space travel. It struck me as something that like could be plausible, but I couldn't immediately think of a specific one that would be a like rock star candidate. And I felt that overall, it's probably not a great idea. And then I asked you, like, how do you feel about that?
I mean, I feel the same way because when you think about some of the common surgeries that have to happen, like cholecystectomies or appendicitis, appendectomies, these are things that rarely happen to begin with. Like, they're not something that 30% or 40% of the population end up experiencing. However, I think, Kyle, when we were talking about you brought up the point of potentially like bilateral mastectomies in the setting of a patient who has a higher risk of breast cancer in the family. That seems to be a good idea. However, the point that I did want to make, when you put someone through screening or like screening guidelines, you're trying to see like, should I operate on this patient or should I do something, some kind of intervention? A lot of our calculators are already or even genetic counseling are already only based on patients in the general population, not patients who are undergoing space travel. So I'm sure that based on data that we accumulate in the future, that potentially may change because of the higher exposure to radiation and solar radiation, cosmic radiation, or whatever, what have you. Just even being on like maybe even on Mars on the red planet, does the dust there confer an increased risk?
Yeah, I thought that was a really interesting conversation we had like prior to the us airing, and it was kind of predicated on like this is all a thought experiment, but it's like what procedure would you want to do prophylactically? So say you're against it, you start out against it, okay, but what one would you want to do prophylactically? Or like what intervention would you do prophylactically? You would want, you know, uh, there are particular things you want to do prophylactically in spaceflight medically, but you know what are the more benign ones? And so I talked about bilateral mastectomy as a relatively, you know, I mean, very invasive, but that's done like routinely in people normally. So it seems like that could be an interesting you know, leeway into doing prophylactic surgery of different types. It's like where, like, to assess out where our boundaries are.
And of course, with these surgeries, a lot of them are based on what the patient thinks is best for them, even in the face of whether or not it's a high, like it's an intervention that'll have a significant impact or not.
Yeah, so I think what this article, which I read it a little while ago, so I mean I'll probably reread it a little bit on air tonight. But one of the things that's often brought up is like, you know, removing the appendix. Like, you know, oh, this appendix is like, you know, it's pesky. You know, it doesn't like quote unquote serve a big purpose, and it only causes problems. So let's just get rid of it before it causes something bigger. And yes, I thought an appendectomy, which is done, you know, incredibly routinely on Earth. Never really heard of it being used for, you know, being thought of as prophylactic for astronauts. So curious what you guys think.
Yeah, I memean, it's super interesting because of the fact that what's happening in space is not what's happening on Earth. And I know it's kind of like an obvious thing to point out, but does gallbladder physiology react to extended space flight travel? How does you know, are you more likely to get a fecal lift? Are you more likely to get some kind of thing that gets stuck in your appendix and then that thing just gets super upset on you and then now you got to have the surgery? Does that happen more often in space or like because based on the article that you sent, it seems like there's a lot of data that is missing in their calculations to begin with because they have to like substitute general population or people who are working in like the Antarctic or the Arctic, for example.
Yeah. Yeah, I think in terms of initial takes, like I'm pretty firmly, or at least I was pretty firmly in the no. Like you should not be doing this, and yeah, just there's just been multiple you know, articles that have come out, and actually another one that I'll pop in the YouTube chat. This wonderfully, dare I say, horribly written article on it had. The title of astronauts may get their spleens removed during or before long-term distant flights, and it talks about how like in very it's not a great article, but this is just I show this to highlight that people are thinking about this, and it's on people's minds as like, is this something that we should be doing? Like, why the spleen? You know, its inflammatory role. I don't really see why you'd want to remove the spleen. If anything, you'd want to keep it in. you know,
Yeah.
during, you know, radiation events and, you know, clearing of red blood cells and you know, its immune response will be you would want it there. So why are they thinking about removing it? So this is a horrible article, and it's in the YouTube chat right now if you want to look at it. But there are people definitely thinking for it and for against it, and so if you want to look at this article a little bit more, a little more in depth, they looked at either appendectomy or cholecystectomy, so that's removing the appendix or removing the gallbladder. And these are like the bread and butter of general surgeons. This is what they could, essentially do in your sleep, and very routine types of procedures. And they ended up seeing like either really small benefit and ended up not supporting the removal of these before spaceflight. So and kind of back to our original conversation, but what procedure would you think would work, like prophylactically? So kind of, what would you think, Ryan or Vlad?
Actually, I just want to take a second to step back for a moment, because I always try to do this and then I inevitably forget until we're already several minutes deep in.
Sure.
But for anyone who's been following along and is just overwhelmed by the amount of I was about to say space jargon, medical jargon that we've already been throwing out here. Essentially, we probably should have started off by clarifying that by prophylaxis we mean essentially once an astronaut becomes a candidate to go on a mission in space, would it be a good idea to take the surgical option to remove certain organs that could at some point maybe become a problem while on the spaceship or space station? And I think an interesting point to go from here actually would be to look deeper at the astronaut candidates. And I'm going to kind of, instead of answering your question, Kyle, I'm going to kind of throw a question back to you first and ask you this. If a resume showed up at NASA for a specific, potential space or potential astronaut candidate, and it said that they already had an appendectomy at some point in the past, would that be looked at as something that was favorable, or would that be looked at as something that's unfavorable?
Yeah, I think in... I'm sorry,
please.
are you done? I'm sorry.
Yeah, I'm done. Sorry, I'm done monologuing.
No. I was just I'm just eager to talk about it, because I think that conversation is shifting, which is the cool part about space medicine in the past several years. So what I would call old NASA or old, the way that it was done decades ago, is that you had to be a physical specimen, it had to be absolutely perfect. And any surgical, the idea was that you had to be physically perfect. And more recently, as space is opened up to more civilian, civilian routes, it's that line is lowering, and that's they're not doing missions to the moon, they're not doing missions to Mars, so maybe that is a different line, but I think that traditionally an appendectomy would be viewed negatively. So the devil is better than the devil you don't know, and so I think you would rather deal with someone potentially developing appendicitis, rather than having some kind of unknown surgical complication. The risks of developing appendicitis are well known, maybe, and less so in space, which is kind of maybe where this line is coming into play. But I think any type of surgery has to be disclosed. Even serious dental work is disclosed, and so I think an appendectomy would be viewed negatively, but not a deal breaker, I don't think, by any means.
Okay. Interesting. I feel like that's kind of an important question to ask, mainly because sometimes when astronauts are selected, they have as far as I know, several years before they might end up going into space. So it's not as though the decision to do an appendectomy or the removal of an appendix, prior to launch is like, hey, we're launching on Thursday, so let's get this appendix out, on Tuesday. It's
Yeah.
like maybe they would have years post surgery to let that all the wounds and everything stabilize. So, but yeah, so if you're of the mind that like it would be a negative just to even have that in your record, then it seems like it would be hard to justify it, at least to the old school of thought when it comes to selecting astronauts, that prophylactic surgery would be a good thing in any way.
Yeah, and I actually have a little bit of a follow up. So it's interesting because I recently found out about another astronaut who had, I think, some kind of spinal surgery. Either like, so typical types of spinal surgery involve changing how the disc looks. So you have your vertebrae as a set of bones, and then in between those bones are squishy, like, jelly donuts that, soften the blow between those bones, and they help move and all that kind of good stuff. And so problems arise when people get older when they have those bones that are touching bone, and when their disc can shift and do all that kind of stuff. And so it can cause, different types of postural differences, pain. Lower back pain is like the most common medical symptom, according to Medicare or Medicaid data. So it's like the most common thing you could people go to the hospital for. And so I think either a shuttle astronaut or an Apollo astronaut had some kind of spinal work done in terms of like putting rods or plates in the spine, and they had some of that hardware removed. So they had this procedure done, and the point of what I'm trying to say is maybe the idea that they had to be physically perfect was wrong from the get-go, and it was just kind of like kind of shielded behind their heroicism, and they had to be this perfect thing, and it's how they were portrayed, but not actually how they were. I think they definitely have to, you have to meet these certain physical requirements, but maybe the idea that, surgically they have to be clean and all that kind of stuff, maybe that's not true. And another anecdote was about Chris Hadfield. So he had a nice book published a little while ago. I actually got to shake his hand once. Never watched it since. So, yeah.
You gonna tell the med school what you're at about that?
Yeah, so I just I just held it. I just keep it in the OR. I just keep it behind my back.
He gloves up. He gloves
yeah,
up.
Yeah,
it's all
exactly.
good.
He actually had some dental work that was like called into question, or something like that. So maybe it's not a uniform thing, and it's a case by case kind of scenario. And I think with the number of astronauts, I think it undoubtedly would be case by case because there's so little number of them.
I tried to, while you were talking, I was trying to get a bead on some of the some of these things that we talked about, like whether it be appendicitis or inflammation of the gallbladder, or just a problem with wisdom teeth or something, like one of these really easy common procedures on Earth. I was wondering if there had been cases where these things had happened to an astronaut while they were on the space station. Have you been able to find anything like that? As I haven't had a lot of luck.
Yeah, I know that it's very common for people going to Antarctica to medical personnel to also be trained as to deal with dental abscesses, so problems with the teeth or particular gum diseases, that kind of stuff. And I believe astronauts are all trained to the level of emergency medical technician, or EMT. And I believe that they get routine dental, they kind of understand routine dental work as well as part of their training.
that's so cool, man. That's like one of the reasons why I want to be an astronaut, low key. But
To do dental work?
yeah, I want to be able to do everything that I'm supposed to be able to do, but I also want to be able to do dental work. I want to be able to like cut hair. I just think that's so cool for one reason. I just think that's so cool.
For
I mean,
some
come on,
reason,
you guys would trust me to work on your teeth, right?
oh, absolutely. For some reason, your comment just like takes me a little. Like I just didn't realize that was a part of you. I didn't realize
think
that.
That's cool. I mean, I would never want to be a dentist, but I just think it would be so cool to be able to do dental work as a doctor.
Yeah, that's.
Or as an astronaut, sure, that's fine.
I mean, don't get me wrong. I really want to learn how to like do basic like electrical work and like robotics and coding and things of that nature. And I thought that was really cool how astronauts essentially have to do all the like kind of like handy stuff on the space stations.
Yeah,
So I feel that.
Yeah, you're the plumber, you're the electrician, you're the IT, you're the scientist, you're all those things. So
lots of hats. Sorry, but I didn't not to completely derail us, but yeah. So, do you think even in the case of like a wisdom teeth removal, though?
Yeah, is actually
is that going too far? Is it going too far for prophylaxis?
Honestly, like this is the first thing that I tried to come up with when I first came up with it. It was like the thought experiment. It's like, okay, my general instinct is prophylactic surgery is not a good thing. But what procedure would be? And the first thing I said was tooth abscess or like wisdom tooth removal. And I think that would be, for some reason, and maybe it's like a blind spot for me, but because it doesn't normally fall, as we kind of just said, doesn't fall into the normal purview of a doctor, like an MD. It feels like it'd be fine. It feels like that's you would want that, right? And so you would want to, especially on a long duration mission, and they had their wisdom teeth in, and they had signs of dental caries or kind of tooth decay, and you had root problems, that kind of stuff. Like you would want to do that prophylactically. So
yeah, it'd be a shame if your astronaut candidate like had a perfect resume for everything except the fact that they like once had their wisdom teeth removed. I don't know.
Yeah.
Like that, to me, that just seems like it's a no-brainer that's not an issue.
Yeah.
I think that the only real complications that I would worry about is someone who is like a medical evaluator for astronauts, or like, if I'm so lucky, a doctor for one of these astronauts would be the proximity to the launch window, right? Like, if this had happened weeks before, or maybe they had tooth problems during their training or something like that, that's something that would raise a little bit more of a red flag with me. But at the same time, like the main complication I think of is related to like easy bleeding. Like if someone had like a blood clotting disorder, like hemophilia or like von Willebrand's or something, just one of those blood clotting disorders, like that's the kind of thing where I would maybe take issue. And maybe people with blood disorders aren't even like selected. Like maybe that's enough where they're like, hey, you can't be an astronaut. I don't know.
Yeah, and I think all of our just to kind of guide our conversation. We're talking about astronauts like through the traditional route. So like becoming NASA, ESA, or Roscosmos or JAXA, because there are like literally in like 4 days there are going to be 4 civilian astronauts leaving the Earth that have far from perfect medical records, and they're very inspiring. They're literally called Inspiration 4, and they're so we're that you can going to space is becoming something where quote unquote normal people can go, people like you and I, and just all people that are medically not the complete fittest. So. So yeah, it's just I think we're talking about like when you have a government organization putting their seal of approval on someone launching to the moon, it's just a much different conversation. And so I think we're talking about that. That was just a quick clarification.
Yeah, right. Yes. Thank you. Thank you for clarifying that.
Yeah, not so quick. I mean, it's a podcast, so we can talk a lot about stuff. Yeah, so I think wisdom tooth removal, like I almost want to like move like the like where do you lie? Like what is the procedure that just crosses the line for you and says like, you know, I would prophylax for this. I would do this prior to flight to reduce risk, and this one's too far. So I think wisdom tooth removal is in. It sounds like for everyone. What do you think, Vlad?
I mean, I don't know. It's hard to say because like I have a wisdom tooth that erupted and it's fit nicely in my mouth as far as I understand it. Like, does I guess it really depends on like the dent. Like at the moment, I guess the way I understand it is that a lot of these prophylactic surgeries, the decisions that we're making, are based on populations that are living on Earth, right? Do you get an appendectomy prophylactically? No, you typically get it when it's gonna burst on you, right? And so the answer is like, well, what about in space? Now in that case, like, do you have a higher chance of getting an appendectomy in space? Because it's already like super low risk, and I don't think the risk of preventing an appendectomy outweighs the risk of getting like an infection post surgery. Because think about all the time that you might potentially lose on training when you get this surgery, or the risk of like getting a small bowel obstruction when you go into space. Like I don't think the risks outweigh each other necessarily to get the prophylactic appendectomy. But then when we're thinking about like another risk factor, like say some kind of cancer, well, we have guidelines based on those cancers to do certain things, but they're all tested on for people in Earth, not so much for people in space. So at
Yeah,
the moment, I feel like I really want to get any. I wouldn't recommend any, or I shouldn't say I wouldn't recommend any. I don't have any training or qualifications to recommend or not recommend. So
I
I'll say for myself, I feel like I don't think there's really any surgeries that I potentially would want to get at the cost of like some kind of like surgery problem happening after the surgery, like an infection
yeah.
or maybe scar tissue forming. I don't want to get that just because I have a 0.0002% chance of whatever bad thing happened to me without any risk for it.
Yeah, I think one thing that's kind of important, one line in the sand for me that I'm kind of uncovering as you were talking, was that, you know, one reason to prophylax for spaceflight would be to prevent something that is happening specifically because spaceflight's imposing an untoward risk. So it's like, oh, radiation's causing a huge problem, so let's do a mastectomy, which is removal of the breast tissue. That's kind of done for women that are at high risk for breast cancer, that kind of thing. Or would it be like if you and that's because it has a clear mechanism, like from the spaceflight risk, which is very much elevated from radiation, to a particular disease. So I feel like in that case, that's when the idea of prophylaxis comes up as a legitimate thing to consider. But otherwise, you would want to prophylax, like do wisdom tooth removal, just as the course of normal treatment. Like if it's indicated in them for them normally, you would want that. And if your tooth is fine and you wouldn't need it because like I feel like it'd just be a part of your normal treatment.
I would actually argue that, and I'm not equipped to like defend this statement right at this exact moment, but I would argue that something like dental caries actually do have an increased risk in the space environment, just because I have what I would call preliminary research into how the space environment affects the immune system. So I don't know, like it sounds like, if I'm trying to sum up your two perspectives, it seems like from the lad, it doesn't sound like anything is good, especially for short duration trips. And the tools that we currently use, the risk assessment tools, we would need risk assessment tools specifically for space, for you to be comfortable, like at some point maybe giving me a green light for prophylactic surgery. Does that sound fair, Vlad?
Oh yeah, for sure. I mean, I think we need to have the data in order to make a good decision because I mean, I don't want to, as our astronauts of yore like to say, venture forth proud like into unknown territory and all that, but this is territory that I don't want to venture in and then potentially put people
Yeah.
that we've spent a lot of time on money training for space flight only to make things worse for them, Like I guess it's in the case of rare diseases and rare complications of space flight travel, I guess maybe it's better to wait and see what the complications are rather than try to do something that may pose much more harm on them than protect that than good.
Hmm. Yeah, I think the part of the question is like, you know, the particular studies that derive like those risk assessments that you're talking about. They take like thousands of patients, right? They take years of research and
Yeah.
the amount of time and effort it would take to get to that point for spaceflight like seems like the distant future. And maybe it's not, but it's at least a couple decades at least.
I think the
Yeah.
primitive
And
way,
so it's like
Kyle,
we have to like do something in the meantime, I guess. Go ahead, Ryan. Sorry.
I was going to say the primitive like way to adjust a risk assessment tool would be, like suppose the tool uses like a scoring system where like a higher number is bad, like immediate plus 10 to the score because you're in space kind of thing. Uh, Something of that nature, I think, could be achievable even without like the thousands of individuals. It's kind of like one of those. We have limited people in our sample, therefore we need to be super conservative with our estimate. But yeah,
Yeah,
so Vlad, you're just kind of a no then in like all fronts, right?
yeah, I'm all about that you know, waiting and seeing rather than trying to recreate or trying to do better than what million years of evolution have set forth. But
Hmm.
the arguments against that is evolution didn't really prepare us for space travel or living past the age of 40. So there are things that we do need to do in order to you know prepare ourselves for future space travel, but it's such a challenging thing, and especially with like long-term travel, like we have such limited data on the astronauts that do go into space, but they're only there for like a couple months or so. What is that going to look like when we you know take the fifth graders of our year and then send them off to Mars in 2030? Like what's going to happen then? Maybe we should have done something. Hindsight 2020, I don't know. It's really hard to say, and I feel like maybe that might be part of the job description. If this is something that a cosmonaut really wants to do, there is certain levels of risk that you're going to have to deal with in order to push the boundaries of science. Like if you asked me, hey Vlad, do you want to go down on the bottom of the ocean to do, certain trainings, like I can't expect the organization that I'm working with to just make sure that everything's going to be okay with me biologically. It's just I know that myself, I have a very unique body type. I have a unique set of genes that predisposes me to certain risks or not risks. And I'm just going to have to deal with it when I go down there.
Hmm.
Yep, you're
What
special.
kind?
You're special, Vlad. And you have a unique body type. You have a unique genetic
Aw,
signature. You're just special.
Can I
We're
read
all
for you
special.
guys?
What's up?
I love validation.
I would love to reframe this for you guys. So, just to kind of like put a little bit of a spin on this, suppose you two are living the dream. You're space doctors, and each of you has assigned. I'm just gonna like get you there. I know there's a
Yeah, just
long,
get
arduous
them.
process.
I can
Med
see
school
it
is in the
now. I
rearview
can see it
mirror.
now.
You've done your residency. Perhaps you've done multiple residencies at this point. You have your astronaut patients, pre-astronauts, okay? And suppose you're reviewing their chart. They've already been selected. They're going into space, okay? And suppose in your chart you notice that your patient has a history of dental caries and like intermittent jaw problems that appear to possibly be like infection risks and stuff like that. And then you notice that they haven't had their wisdom teeth removed. Now, I guess it's hard for me to like add to this hypothetical, like I don't know, like how many months or years would need to be we would need to be from launch for this to be a good, like a decent, well thought out question. But just for the sake of discussion, I want to ask you, like, having seen a history like that on someone you know is going to wind up going to space, would you consider, like, you know what, like, I'm willing to send this person to space, and I'll just hope that even though they have a history of this popping up, I'm not going to do anything about it this time? Or would you potentially be like, you know what, let's like get their wisdom teeth out, like they've had them, they probably should have had these taken out a long time ago, like now's the time to do it?
Oh, that's hard. Are you saying that that one of the residencies I've done is as a dentist?
Well, I would say
Residency?
You can still, you gotta, you know, you can have an
still,
informed
I
position
feel
on
like
it.
you could still weigh in on this.
Yeah.
Yeah.
I think at that point the important
I
thing is to
feel
kind of like
defer to the dentist.
defer to the dentist. Yeah, I mean, at that point, it's really. I guess it depends on like the length of the mission and also like prior authorization and clearance. Like if the dentist thinks that this isn't an issue, right? And I'm convinced that this isn't an issue, and the mission's only for like a couple months. I don't see it as being a huge problem, per se. But if you know, since this is an interdisciplinary, a lot of people are working on this together. If a number of people are saying that this is a problem, then of course you're going to want to remove the wisdom teeth, right? Especially if they've been a problem before, you want to take them out for sure.
Mm-hmm.
Yeah, I think my answer is sit down with the astronaut and talk to them for like hours about it. Like, hey, so we have this thing in your chart. I'm concerned about it. What, like, you know, do the classic reflection. Like, are you concerned about this? Like, you know, what do you see as your biggest problems? Just talk to your patient and just continue to talk to them and understand where their head's at with. Do they even see this as an issue? You know, not even guide them down a particular path to start, and just say, hey, like, you know, some people get their wisdom teeth out, some people have them, some people live with them. You know, explain all the options and say, you know, where do you feel like you lie, and like let them decide a little bit, and then just kind of continue to work with them. Like you're essentially a concierge doctor, like you're their physician, and you probably know them super well. You probably know their family super well, and so in terms of like taking care of wisdom teeth, like, you know, you would, you know, take a, you know, a thorough history, and then you would talk to them like, hey, you know, what are the consequences if you don't do this? As practice, like how would you brush your teeth in space to make sure that you get, like, you know, how you get the toothpaste like exactly where it needs to go to take care of this. I think, you know, you would have to go through every eventuality with any medical condition with an astronaut, but particularly one that you have some suspicion that is going to come up if they have this recurrent kind of thing, and then see where they go, and then because you're not going to have those numbers, you kind of just have to leave it up to their decision and whether or not the mission director or other people in the NASA community are okay with what's happening.
I feel like I should have made this example about gallstones or something like a little bit more in our purview, but
I mean, we can, like, you know, we can move up to that, you know, if you want.
okay, like, yeah. So suppose your patient, you know, they've already been selected. They're going to go to space in like 6 months, and in their chart you see that they have a history of gallstones somehow. I don't know if this is something that would just have had to have been overlooked, but or maybe you uncover through interviewing them after they've been selected and everything, received months of training, that they have a history that's consistent with previous gallstones, and in the past they've either, you know, managed to deal with it, like the gallstones were never significant enough to cause any obstruction, or their gallstones came and deteriorated. Like,
Yeah, it could be non-symptomatic until the time like pre-launch. You know, you could
Sure.
be you pick it up on ultrasound when you're looking at ejection fraction, or you're looking at kidney function, or something. Like you're ultrasounding around, you just decide to go over to the gallbladder and you pick up a bunch of stones. What do you do? That's a great question. Vlad, I'll leave it to you. I can't see if you're motioning to talk in or not like that, so I'm gonna toss over to you first.
Yeah, sure. I mean that I'm pretty sure. So here's the interesting thing about this patient case, and it kind of connects originally to what I was saying before. Is a lot of the prophylactic questions that we're asking and answering at the moment are already kind of like answerable for the general population. What do I mean by that? When you have someone who has like significant gallstones on like on previous imaging and things of that nature, and they've shown maybe they've had like a couple of episode like a couple times where they're like, oh, I had that classic, I got gallstone problems. I'm pretty sure there are indications for a surgeon to take that out. Like that's standard practice. I'm pretty sure. Now I'm not a surgeon. I haven't done a surgery residency. I could check up to date, and see if that's the case. But if it's there, of course you would remove the gallbladder. I think the interesting thing about this topic that you brought up, Kyle, for today is if you have someone who's got a completely normal background history, minus a couple things that are pretty inconsequential. Maybe you have like two family members that have breast cancer in their 60s, right? Or maybe you had one episode of pancreatitis or something, or you had like one episode where you had that classic gallbladder stuff, but then imaging and everything came back normal. You just had one episode of it. How does that change when you go into an environment that hits you in a different way than on Earth? Do you now suddenly have a greater increased risk of breast cancer because you're constantly being exposed to radiation? Are you more likely to get some kind of gallbladder disease because of microgravity and like the gallbladder tubes, and it's kind of messing up that how the gallbladder pushes all that stuff? I'm trying to find like the layman's term for stuff. But like, how does that change when you're in space? Because I feel like in the cases that you provided, absolutely, you do prophylactic stuff, especially right before a mission critical situation. But the harder question starts coming in where you have, so these astronauts are going to space, they're critical to the mission, and you don't want someone to have a medical emergency. But what do you do for those people who have a normal history? I think that's really the
Gotcha.
extremely interesting question. Well, I shouldn't even say normal, but if they're better thing to say is if they have no risks for anything besides one or two
Right.
inconsequential risks,
I
do
think you're
we?
right. I agree. So I think that is kind of like the way we began this discussion. It was like, hey, we have a healthy person. Should we just yoink out their appendix and their gallbladder just to just as a precaution because we don't know if like they might
Uh,
have a gallstone or whatever in
I just
space.
love the yoink. I love the yoink. Next time I'm in an appendectomy, I'm just gonna say, gotta yoink it out. Oh my god!
Right.
I'm just
So
gonna be chuckling to myself at the corner of the OR and just be like, oh man.
so for you, like, uh, I mean, so I see where you're coming from, and just to push back a little bit, like the case that I was trying to lay out was one where, for me, like if I find an incidental finding that someone has like a gallstone, and they tell me nothing, like nada, would I on here on Earth be like, yeah, you should just get this gallbladder taken out anyway? I don't think so. That was kind of where I was going with it. Like I think there are cases where we find the incidental um, problems. Like maybe the wisdom tooth one was not such a good example of that, but with the gallbladder, I think there are cases where like someone could have asymptomatic gallbladder issues on Earth that might make your risk assessment a little bit different and might push you over the edge of like um, the prophylactic surgery edge. That's what I was trying to get at.
Hmm.
But I agree with you that um, that wasn't really the how we started the conversation.
Yeah. So where do you want to move forward with Vlad's question? Like, you have a completely normal patient. What do you prophylax? Like, what do you? Is that where we want to move forward with our discussion?
Yeah, and that's like the scary thing is because you don't like what we've seen before in history, right? Is like we don't know things are a problem until like we pay attention to something. We have patients. I don't know, like classic examples like There, I can't remember specifically the hospital, but a lot of pregnant patients who went to that hospital to give birth, they just ended up dying all the time. And all the patients that went to the sister nursing hospital ended up, surviving their pregnancies. And at the time, nobody knew what was going on, but all the pregnant patients wanted to go to the sister nursing hospital. And the reason, and essentially, looking back, the reason why that was happening was because all the doctors and doctor students were working at the hospital where they would do autopsies, not wash their hands, and then go deliver patients or go deliver babies. And then because they never washed their hands, all of the bacteria that they collected during the autopsies killed all the birthing mothers and babies.
Wow, that's
But
quite a
at the time,
story.
and essentially, it's how we discovered that hand washing is an important thing, right? There was one doc. I think the lead doctor at the hospital thought it had something to do with miasma going in through the ventilation system, so they
Hmm.
like put in a new ventilation system. But unfortunately, that's the time when one of the co-doctors decided to have everyone wash their hands because that's what the nursemaids did all the time in the sister hospital. So they didn't quite get it until a couple of years later. But that's essentially the story of washing your hands. And I feel like I don't want to see that kind of happen again with like space travel. Obviously, we have the scientific method now and we're a lot more rigorous, but you kind of have to collect data in order to make decisions on it, but you don't want to do that with sending astronauts off into space to begin with.
Hmm.
And it's such a
Yeah.
poignant and interesting question, and I just wish I had a lot more information to look at besides the articles that you found and that we kind of like read over, because based on the data models that we're looking at, it says let's not do prophylactic surgery. It doesn't outweigh the risks. It doesn't really do anything. Doesn't really protect astronauts or cosmonauts. But on the other hand, well, that's limited data. We don't know what's going to happen to
Hmm.
people with long-term flight travel in space.
Yeah,
We
I
don't know what's
mean,
going to happen.
yeah, not having data is like just going to be a part of being a flight surgeon. A flight surgeon being the doctor that takes care of astronauts. It's like you're not going to have data on all the stuff, but you're still there to make a decision. And so it actually kind of bleeds over into like almost like a bioethics kind of way of looking at things. It's more of like an ethical standpoint. Like with what knowledge you have at what point does it make it a kind of a decision that isn't scientific, but is kind of more of a guiding philosophy.
I actually think this comes back to what you were saying earlier, Kyle, when you were talking about how you would approach these kind of cases and how you said to a large extent you would want to have like a very in-depth conversation with the astronaut who is the one accepting the risk and basically uh, won't have a, any great way of knowing either way, like which one is the better choice.
Yeah, the patient often knows best on how they'll well perform. So it's like hey, you're going to undergo this procedure and you're going to have all these different things. Like, how will you respond to that? Like, they'll be like, oh man, this one time, I responded very poorly to this, or like they know themselves better than you ever will. And yeah, also like you know, I did philosophy classes in undergrad, and a lot of the medical ethics stuff. You know, this topic feels more and more like a bioethics course than anything. It's like do you deal it case by case? Do you deal it with how do you begin to weigh these particular risks? Like, we can talk about the actual details scientifically, but once we have them hammered out, like what do they mean morally? And it's very interesting.
Yeah, 'cause, I mean, the thing that's underlying one of the main things that's underlying this conversation is this is mission critical. Like, you're sending very few people on a very complicated mission, long term. I mean, today at the Johnson Space Center, I learned that you can have communications delayed up to 2 weeks if the sun is between Mars and Earth. 2 weeks is a very long time. Like, if you have a bacterial infection, things can get real bad real quick over the course of a couple of days. And if you don't have a doctor that's able to like tell you what antibiotics to take, what you should be doing, You know, kind of reminds me of the Soviet scientist that did his own appendectomy during one of the I
Hmm.
think it was an Arctic mission, right? Like
Yeah. Actually, this is a
it's
beautiful transition, Vlad. So, as per the title of today's orbit, we talked about doing surgery beforehand, and we're still kind of divided on it, and I kind of haven't resolved it. But what about doing surgery during spaceflight? So here's another article that I'll post in the chat. It talks about what it would take to do surgery in space, and how insane that would be. And so just wanted to take over that transition a little bit, and I'm going to give it back to you. So now hopefully we're going to talk about doing surgery in space and what do we think about that. So Vlad,
take it away, right?
you can continue. You can continue with your. You were talking about how like light lag. You were talking about during like what happens if you have this like while you're on Mars. Like what if you're on route and something happens too? It's.
I mean, there's a lot of gore. There's a whole lot of stuff that's going on. Um, One thing that comes to mind is maybe it's potentially possible because I saw that the first American space station, the Skylab, they had the way they took showers was they had these little plastic bags that they would crawl into, and then they'd zip up the plastic bag, and then they'd shower in the plastic bag. And so I'm wondering, like maybe maybe you could have like little sterile plastic bags that you do surgery in like
Yeah.
microgravity.
Oh my
So,
god.
so if you guys look at this article I posted in the chat.
Oh, actually, that's actually kind of genius, dude. I just envisioned what you. Sorry to cut you off, Kyle.
Oh,
But
you're good. You're good.
I just envisioned a space like a shower bubble thing with like how for like handling hazardous materials you have like the gloves that go into it from the
Yeah.
outside. You could potentially like have someone do surgery on someone inside a bubble, maybe
Yeah.
something like that.
And that way you're not spreading gore all over the place. But at that point, maybe you need to have like some kind of like
Like a vacuum
special
cleaner
helmet with like
there.
windshield wipers to clean off the viscera. Because I think that's the biggest problem.
Yeah.
So if you guys look at this link that I posted, there's a little like photo of what they inside of this like space station or spacecraft. There's like a Da Vinci robot of sorts, a person that's like strapped down to this table, and then like some person operating this device, and just all of this is like under 1G, I think, because it looks like it could probably rotate. And so this is kind of their imaginings of what space surgery could look like.
Oh, wait, where did you post it?
The second link that I posted in the YouTube chat.
Oh, in the YouTube chat.
Yeah,
Got it
sorry.
up game as well. That's where I'm looking at it. I think my first thing, my first thought is I guess Vlad, to back up for a second, Vlad was talking about someone who did surgery on themselves in Antarctica.
Yeah.
To me, that seems like maybe a kind of like best case that they themselves or another astronaut be there. Probably that's more preferable to do the procedure, because I was just imagining like all the problems that you would have with remote surgery, because you're probably not going to be bringing a surgeon on your mission, or maybe at some point you would need to consider doing that for really long-term missions. But like also not only like imagine you could like sedate someone and have the surgery like pre-programmed out or something like that, and they're just tied down and can't move or something, or maybe you've got like machine learning guiding your Da Vinci machine. But like even anesthesia is like a touch and go, like moment by moment, tightly regulated process, right? So with even like a couple minutes of delay, I feel like things could go catastrophically wrong. No?
Yeah, absolutely. I mean, I don't think you would ever attempt it across light lag.
Yeah.
Like, I don't think like it would just be so. It'd be way too risky. And so also doing it on orbit, with all some of the major changes that happen to the body in space. You have radiation. You have fluid shifts as like kind of the two major ones, and then you have musculoskeletal, kind of atrophy, and then you have like isolation confinement, kind of more psychological. But performing surgery is, especially abdominal surgery, which is what we kind of alluded to in the prophylactic side of things, doing it beforehand. This article, says from floating guts to sticky blood, here's how to do surgery in space. And so the article is, it's just like, it's all for fun. It's a news article, but yeah, so like what it's getting at is, the surface tension of liquids prevails in microgravity because you don't have gravity to kind of pull things apart. And so if you have like a blob of water or fluid, it kind of sticks together. And so your abdominal cavity is, essentially a series of tubes and certain solids going through some tubes, liquids going through others, and certainly affected by the spaceflight environment. And when you start to perturb it and upset it, these things they're not gonna fall to the bottom of an OR floor. They're not gonna go well into a sponge. They're not gonna be suctionable in easy ways. So surgery has these many tools for handling fluids, for how you place things on a sterile field. How to immobilize particular joints or particular parts of the body. And so all these things are very, they're orchestrated. It's a very, an OR works as a, it's conducted by, the anesthesiologist, the surgeon, as well as the charge nurse, other people that are working around, and it has to flow well, or else it's not, no one's happy. And so like I just see space as like this thing where things are going to fly everywhere. You can obviously, there have been experiments done on the shuttle. There's a physician by the name of Jay Bucky. He actually wrote a book called Space Physiology that is on the shelf right there. And he did a talk a little while ago about some of the experiments he did on like making a surgery kit for space flight. And so there's like Velcro for like, scalpels and retractors and all that kind of stuff. And so people have been thinking about space surgery for a little while. And yeah, I just think it's a horrible idea at this point. Like prevent. Like aerospace medicine is squarely in the discipline of preventative medicine. Like its residency is housed in preventative medicine. So it's like you just never want to be in this position. Like you got to avoid it at all costs, which is kind of what we brought up with the prophylaxis. So
Yeah, no,
that was a lot of talking. You guys can go ahead.
No, you're absolutely right. Like a lot of this should be preventative. And just for like what's it called? Fact checking. The surgeon who did it was Leonid Rogozov. Rogozov was
the
the guy
Antarctic guy. Yeah.
Yeah. So essentially, the surgery started at I think it was 2 a.m. local time, and it ended up 4 a.m. local time, I think. So it was like a 2-hour surgery. And he developed like some severe, he developed nausea and weakness after about 40 minutes of the procedure. So he needed to take breaks. And then afterwards, after the incident of getting the appendicitis, there were like in 1961 and afterwards, the Soviet Union at the time put in more like strict and extensive health checks in order to prevent this kind of thing to begin with. So that kind of like already supports your statement that the idea that all of this should be preventative. But I guess now this kind of adds a new dimension to it, because when you're thinking of preventative, you kind of want to prevent bad things from happening. And I'm guessing you want to prevent surgeries from occurring as well, because surgeries are a very significant, heavy thing to do to the body. When you're, taking anesthesia, that's like an insult to the body. Removing an organ, that's an insult to the body. So maybe the preventative should also include like preventing these prophylactic surgeries to begin with. Maybe that's a dimension to take as well.
The prophylaxis for the prophylactic surgery.
Yeah, just like put everybody on antibiotics for the entirety of the trip.
Honestly,
and that's
that is a thing. Yeah, go ahead. Sorry, that's a thing.
No, I'm sure you've probably heard about how, depending on where you do appendectomies, like removal of the appendix, Like some things you could do, like one approach to take is removal, and I think that's the most common one. But there is something to be said about how, like, depending on how you feel, you could just give antibiotics and see how you respond without having to do surgery.
Hmm.
Yeah, I
And
mean,
that is
go ahead.
no, go ahead, please. That's all I wanted to say.
I'm sorry. I'm just like chomping at the bit again. I, you know, one thing to consider is like if you have a non-surgical intervention, you can try it pre-flight. Like many months or years prior to someone going up, and you say, oh, how do they respond to these antibiotics? How do they respond to a new diet change? So say you have a gallbladder, you have gallstones, and you try putting them on like a low-fat diet because the gallbladder stores bile, which is like a fluid that's produced by the liver, and bile really helps to like break up fat in the diet, and it helps like your body absorb it, and problems happen when this fluid can build up in places that it's not supposed to, and so essentially like you could say, oh, this person has like gallbladder stuff. Like, let's see how like a lifestyle modification works, and hopefully your patient, your astronaut patient, is going to be like one of those good responders. Like is someone who sticks to what you prescribe or what you recommend, and I definitely see that as a practical way of approaching any of these problems. Is like, oh, you have this thing, let's try it out before you go up.
And that's going to be so important for kind of like future space travel too, especially with like commercial space travel. Now that that's turning into a fast-growing industry with the three astronauts or so that paid quite a significant amount of money. I think that was like out of pocket when they took the was it Blue Origin? I think.
Yeah. So yeah, the Blue Origin people were it was Bezos and I think one person who paid a significant amount, and then I think he invited. I think her name was like Funky or Funk. I forgot her name, but she's like this crazy accomplished like pilot, and like something that everyone should look up to. She's just like the coolest person. I'm really happy that she was able to fly.
Yeah.
Yeah, but they had to pay a bunch of money. Someone had to pay a lot of money for that. Yeah.
Yeah, and that just kind of harkens to the importance of space tourism. And at that point, you're gonna really need to, open like lower restrictions because you want people to be part of your business, but then on the other hand, you don't want, to have an emergency in space, right? So
Yeah,
it's
I mean,
gonna really.
yeah, you're gonna really put a hamper on it. Is that what you're gonna say? I'm sorry, I can't see if when you're about to be done.
No, no, no. Yeah, no worries. This is definitely. I'm hoping that things will get better after 2 weeks when I'm back in Michigan and I have stable internet. But yeah, it's gonna put a hamper on things because you want to give everyone the opportunity to go to space, irrespective of how much money they make, right? But in doing so, you got to make sure that people are healthy and fit to do so. You don't want some, and healthy being, healthy isn't just like what you think of like what a normal person should be like, but they're doing everything they can to prevent some kind of bad thing from happening when they travel into space.
Yeah, I think the advantage of civilian spaceflight is that it only usually occurs, like you talked about Blue Origin and Virgin. They're going to space, for like minutes, and then like Inspiration 4, like they're going orbital, which is 1,000 times harder, but they're still only going for about 3 days. And so I really envision that civilian spaceflight, even though it presents a problem with medical histories being more complex and all that jazz, I do see their limited stay, like an acute exposure to space, is not the issue. Like I don't think there's much issue with going to space for a couple days. I think almost anyone can handle that. Besides the G forces about entering and deorbiting and all that. So yeah, that's my 2 cents.
I was going to jump in, and so I think we've been going for about an hour and 15 right now. I don't know if Kyle, you would enjoy pulling up our ISS tracker, but
Yeah,
I wanted
sure.
to like introduce maybe like a topic that we kind of haven't really gotten into it all so far for maybe the last couple minutes. I was sitting here thinking while you two were talking, are we in any way even equipped currently to do surgery, even though obviously for a plethora of reasons that we've already kind of discussed, it's far better to be on top of these things from a preventative perspective. But supposing our preventative measures failed, do either of you know, are there any existing surgical options that exist in space at the moment? Like, say, for instance, like for an amputation, if that had to be done in an emergent way, do we have kits like that? Because and B, are some of the things that we would need to do it in space, like Velcro tools, as Kyle alluded to, and I was thinking even like IVs that we use here on Earth, they use gravity to function. Like, do we have IVs that are like electric pressurized devices just that deliver fluid?
Can't you just get a medical student to squeeze the bag?
Sign me up as the medical student. I'm ready to go.
Excused, right? Any excuse. But yeah, so are astronauts like trained or even are they even like brought up with the idea that like, hey, maybe you have to saw off like the leg of one of the other astronauts at some point, like cauterizing wounds? Like I have to imagine that some of these things we can and are prepared to do already. What are your thoughts?
I mean, so here's the thing. Yeah, here's the thing. So the thing is, they do have pressurized stuff to begin with, because I saw some experiments where they had like this wicked pipette that was connected to this like hose, and they're able to do like micro quantities of certain fluids in their experiments without having gravity. Like, it's crazy. So it is. I'm sure it is possible to use a pressurized IV in space. But in terms of like a surgery, I have no. That's such an interesting question to see. I mean, I'm sure they're probably working on it, right?
Yeah, I would think that there's at least one object with which you could use as a saw if like someone's leg was like smashed and there was like no way to get them out, like without an amputation.
Yeah, I think it's kind of interesting because for the most part, for all of the part, I don't know what the other way to say that is, we've been in low Earth orbit. And having a leg smashed and, having to amputate is not really a reality. That's not really on the, like, if you're on the lunar surface or you're on Mars, it's much more that, when you're on a body, a gravitational body, that makes a lot more sense to think about. But if you're in space, so you're constantly falling and you're not hitting anything. So you're actually, the fall risk is not really there.
I would have to think, like, to just spitball like an idea, like maybe a pressurized door closes on your leg or something.
Like a Star Trek,
I don't know. So like a heavy object is like moved into you. I don't know.
Oh,
like
a crush injury? A crush injury?
Like a crush injury, or like, I don't know. That was kind of where I was going with it. Like, I don't know. It just doesn't seem like complete. Or like maybe like a tracheotomy or something like that could potentially need to be performed, or I don't know, like something.
I think that's 100%. Like advanced airways, tracheotomies, all that kind of stuff would be. I think that's a part of the medical kit. I think.
Okay.
Yeah, I think they gotta know like advanced. Well, would that be under the category of advanced life support? I haven't done it. I'm not in residency yet, so I don't have to worry about it at the moment. But for all the doctors out there being like, God darn medical students not knowing this basic stuff.
Study their basics.
So what we just referred to for our non-medical listeners is like a tracheotomy is an incision into, or there's a couple different ways to do it, but essentially an airway that is through a particular cartilage in the larynx, so in your neck. There's a way that you can make a small incision and then feed a tube to help you breathe. That's what we're talking about. But yeah, I don't know. I think airways are really important. Like if you like food and all that kind of stuff is, doesn't go down as easy. So, and evolutionarily speaking, our food hole and our air hole are the same hole, and that causes many people to die every year, and it's kind of silly.
It's gonna be. It's
So
so
I
exciting. Man,
please.
I had this just as like an off-topic thing. I just want to share this when I was at the when I was just like learning about this stuff today. I got so upset about fiction stories and like video games and all this stuff that's focused on this kind of space travel because I don't think we'll see in our lifetimes when we start setting up colonies on other planets and doing these like crazy advancements in science and technology, but in like science fiction we do get to see it and it's so tantalizingly close, but I don't think it's going to be in our lifetime and it makes me mad. It makes me
Yeah.
upset.
Wait, there's like a quote out there. It's like too late to discover the world, and too early to not discover the stars or something like that. Like, there's everything's discovered on our planet, and then we see everything that's in the universe, and we're like, oh man, that'd be crazy. But we're kind of in the in between. There's some quote out there about that.
Yeah, that it's sad. Makes me upset.
See, that's why. I mean, I think there's like the most tangible thing, the biggest step from reality into science fiction in my lifetime, I think, in our lifetimes, would be like a lunar colony or like a Martian colony, like tens of people, like that could happen, and like that's what we're gonna try and do.
Yeah.
And I think I've done this to my parents several times because I'm always they brought this up once when I was growing up, and they looked down at their phone, like my mom was looking down at her phone, and she was just like, if you were to tell me that this thing would exist, like I wouldn't have believed you. And so they're like what I'm getting at is that in our lifetimes there are going to be things that we never thought possible that happen, and that's just like going to be a part of the world, the future world. Like when we're I got more gray hair, and when we're doing when we're old, like on our like by the time that we're looking down death's door, like what is the world going to look like, and we're like, and what is the universe going to look like? You don't know. And so part of that, could that unexpected thing could be human expansion to the first planet, or maybe it's something different. I don't know. Maybe it's like the moon. Maybe it's something else. But I think there's something there. There's too much energy behind it for it not to be there. At least in my opinion.
Yeah. Oh yeah.
Either of you guys have like a good way of spending the last maybe like 10 minutes or 5 minutes of what we have left on our trip around the planet? Something comes up.
I have a good way. So the title of it is Space Surgery Before, During, After, or Not at All. And so just kind of quickly go through like what is your what is your take, like generally, like, whatever constraints you want, and just say what your opinion is on those 4 time frames.
I would go before, maybe. During, hell no. After, probably. I would have to think like at least from the radiation alone, especially if it's a long one.
Yeah, maybe ranking them. Say like, like which one would you rather do?
Yeah, my tier list would be after, before, and during in that order.
And then not at all at the top.
Not all at the top.
Vlad, what do you think?
Ooh. I mean, before if it's indicated, during, after. Again, no. It's all. I'm gonna go with. I'm gonna be boring and just go with the data. And just do what the data says.
What are you, a nerd?
Wow, man,
That's kind of nerd.
Yeah,
That's
no.
I hurt my feelings, man.
No, dude, being a nerd's great.
Nerd.
You're a space nerd. You're a data nerd. I'm a bone nerd. Ryan's a nutrition nerd. We're all nerds of different types. Being a nerd it's in.
Different flavors.
It's cool, yeah.
Well, that makes me feel better.
Yeah, no, you're special. You're our special space nerd friend, and we love you.
All right, settle down.
I just missed you two. It's
it's been a minute.
It's been a minute. Yeah, I think we're all like getting back to our reality. I'm gonna try
to revisit this topic after my surgery, my first stint of surgery rotation.
Yeah, you're just like you're sitting and you're next to the attending, and you're like, so what do you think about prophylactic surgery for space flight? And they're going to be like, this guy needs a 5 out of 5. This guy's great.
Yeah. I'm looking forward to the conversations. I'll be sure to share anything interesting I hear over there.
That, or they'll look at you and say, "Why are you wasting my time?"
They're like, why haven't you changed the music yet? Why haven't you? Why don't you have the next tool I need ready? But yeah, I think our schedules, like Vlad being in Houston at Baylor College of Medicine, Ryan re-entering third year, and me, just getting done with the rat experiment. Really excited to be done with it, and yeah, I think we've all had big.
That's so insensitive. We never reflectively asked you how you were doing in your life. I'm so sorry.
No, it's all good.
Yeah.
The summer's been pretty bad. But now I'm looking forward to looking at data and being done. So hopefully 6 to 9 months done with a PhD and then back to the medicine world. So I'm in one jail. That's PhD world. I'm excited to be into other jail, which is med school. I don't know how re-entry from your year off, Ryan, was back to the third year, but I'll be hot off your comet trail, re-entering Earth.
I'll let you know what to watch out for. Hopefully, Vlad was instrumental in my I don't know, my mental well-being at least. He kind of gave me some tips.
Yeah,
you're gonna do great. You do awesome.
Thank you. The amount of times I've had positive feedback during most of med school and graduate school is not many. So, but yeah, I think to end, I think I'll do my ranking of before, during, after, or not at all. So not at all. And I think it's really the question is before or after, which one's better. And I think it's after, because it's just a known risk. I think it's known, but you could have. What if some calamity happens and the person dies on the surface of the moon? So the risk is a lot higher. But yeah, so I'd say not at all, after, before, and then during. During just seems so bad. During seems so bad.
Too bad we don't. It doesn't seem to have any aspiring space surgeons in the call today. No one who's just dying to go do space surgery.
Tell us what to do.
Yeah, there are a couple. There's a group called the Parabolades. They're medical students in the UK. There's 3 women that all did the Masters of Space Health and Physiology at King's College London, a program that I looked at many moons ago, and was that was the seminal moment when I figured out this was a discipline that it even existed. Was looking at that program, and one of them is really interested in space surgery. Her name is Nina Purvis, and she is on Twitter, very active with all of that. And yeah, maybe I'll ping her after this and see what she thinks. She actually made some immobilization device for surgery. She just got the aerospace medicine student travel scholarship to go to the conference that just happened in Denver. So yeah, she's on the Twitterverse. I'm sure she would be happy for a question. So and I guess just to end, one last thing, another person at Baylor College of Medicine, the person I've talked that I want to talk to eventually is a guy named Chris Leinhart. He's a emergency medicine physician, and he reviewed this article that I looked at the other day, or earlier on. This astronauts may get their spleens removed before long distance flights, and Dr. Leinhart responds, and he says, pretty much, I've never even heard of this being a thing. The cost benefit doesn't support it, and so this is kind of hearing it from the horse's mouth that prophylactic surgery is not really in the cards for something like a splenectomy, which we didn't talk about, or appendectomy or cholecystectomy. So yeah, so this was a fun episode. Happy to get back into the swing of things. What do you guys want to do in the future? And then I'll while you guys are talking about that, I'll get ready to wrap it up.
Man, I feel like we leave behind like a lot of like unanswered and maybe unanswerable questions. It might be fun at some point to do an episode where like we revisit some of these things, having thought about them more, maybe having reached out to experts in the field. Like it would be fun to like hear more from surgeons or like people who are privy to what kind of potentially viable surgical equipment like currently exists in the ISS. And I think that for a lot of our other episodes, there's a number of things that we could shore up to. So that could be a future idea.
Oh, for sure, yeah. I think one of the things that might be interesting too is I know we're talking a lot about space medicine. I would like to think about like one of the things that I can't get over this is the biomining of bacteria and having them create necessary materials for space. So now I'm thinking like, what about like missions or kind of techniques that you can use to gather medical supplies when you go on long-term missions? Because I know there's a lot of titanium in moon dust, so I'm sure you could use that for like scalpels, other things of that nature. What about like IVs? Manufacturing and other manufacturing medical supplies on long-term missions.
Dang, that's cool. That's a cool idea. I feel
That's
like there's
insane.
like
That gets like so.
topic too. That might like gross here on medicine.
Well, I mean that's an important thing, right? Like you can't just expect that. You're gonna be getting like. Is it a feasible thing to expect to just have necessary stocks to last you on a long-term mission, or are you gonna have to make things on your own?
Yeah, they're definitely gonna have like bone scalpels, like tools that like scavengers would like pick up, like, oh man, like I put a rock and a twig together and now it's a hammer.
Are you suggesting that we process failed missions to Mars into usable tools for future missions? Is that what you?
Yes,
because that's what I heard.
Yeah,
oh my gosh.
I'm saying take the bones from the Martians, obviously, because they obviously have skeletons that I want to study. So
fair enough. Reasonable.
Cool.
All right. Well, thanks for joining, Ryan and Vlad. We'll have to do another episode sometime soon. We do have a special guest lined up, a fourth-year medical student who's applying for emergency medicine this cycle, and he co-authored a paper that deals with skeletal adaptations to spaceflight. And he said you want to come on the show. If you guys are around, would love to have you. And so that's what I'm looking forward to doing on the show. So,
hey,
thanks for taking the time. And I know it's not easy in everyone's schedules. So, thanks for joining.
Always a pleasure.
Agreed.
All right. Thanks for listening to Let's Talk Space Medicine. If you want to continue the discussion and meet more fellow space nerds, be sure to check out @TalkSpaceMed on Twitter and the Let's Talk Space Medicine server on Discord. Thanks, and see you next episode.